Chief Justice Wilson failed to mention the most salient piece of information about me. Look closely. My name is a 4-to-1 consonant to vowel ratio. So that's pretty much all you need to know about me. We're going to go way up into the atmosphere and get a satellite view of something, because what I want to do is talk about a new dynamic in consumerism, one that we know about, but we may not really be paying that much attention to. I'm going to show you the face of the new consumerism. Fear. Fear, economic fear. One of the reasons to put a picture like that on a slide like that is look at the chart, the graphic. It's very frightening. Probably everybody in this room knows somebody who either lost their job or who is right on the bubble. And that's happening to everybody. We are all getting hit in a broad sense, okay? It's all over the economy. It's what is driving the automakers way down. People, their homes are being foreclosed, and we can kind of go on and on. But no secret, right? The recession. Well, we have been exacerbating this. We've been setting this up for a bigger fall than we might have in the benefit side of it, the health side of it. Because in the 80s, when we first were doing care management, it was very command and control, and we got in there and did everything. Commercial utilization, if you were around at that time in the early 80s, now we talk about bed days per thousand of 250. Back then, and this is not an exaggeration, if you were working back then, we were routinely 600 to 700. And Medicare was 3,000, almost 4,000 bed days per thousand. It was just astonishing. The very first medical practice I had in Union County, Illinois, way down southern Illinois between Carbondale and Cairo. You pronounce it Cairo, but we pronounced it Cairo. Routinely, I was under intense pressure from the hospital to put patients in the hospital for a 1-week executive physical. Now, these days, the only one who gets to get away with that is House MD, and his patients usually try and die 3 or 4 times, so he gets a pass. Otherwise, we don't have to do that command and control, but we still had a lot of other interventions. We had networks, we had authorizations and so forth, and then we had the managed care backlash. And on my computer is stored pictures of Newsweek and Time, HMO hell, and so fine, we gave that up, and we went back to the old way of doing things. We replaced the medical director with Adam Smith, the invisible hand of the marketplace, and used economic forces to do it. It's kind of the way we used to do it way back when, before HMOs came along. And so the deductibles have been going up. They've doubled in the last 5 years. We've increased the co-insurance, the co-pays, the tiering, you name it. We've got it in there. Every place you turn around, there's going to be a financial incentive or disincentive. And we've put some incentives in there. And you've heard about them in the course of this conference on the wellness and prevention side. There's only so far you can go to it, go with those and because of legal terms. But we also tend to put the same incentives in for everybody. So at the same time, we set up the fact that consumers are paying more out of pocket than ever in hard dollars. As a percentage of their premium, it's about the same. Employers have been paying about 75% of the premium now on a pretty regular basis. Out of pocket, of course, those hard dollars are up, but the way that premium stayed where it was by the extra cost sharing. We've also increased the number of uninsured consumers. They're sort of consumers. Now, we like to say things like, well, we all pay for it because they get their care in the emergency room. Well, yeah, they do, but mostly they don't get the care. And the reason they're in the ED is they didn't get the care, and they are sick. They are sicker than normal. The statistics are easy to read, okay, so we do that. And the number of uninsured, because of the recession, is going to be going up sharply. And I'm sure we are lagging in our count right now. And remember, there's a lot of people living and working in the United States of America that don't show up in the numbers of the uninsured, because they don't show up in official numbers anywhere. They're not documented, but they're still here, and they still have health or illness. Anyway, because of the economic pressures and the existing recession, small employers in particular are saying, okay, we're out of it. The CEO of HCSC, Blue Cross Blue Shield of Illinois, Texas, Oklahoma, and New Mexico, several years ago, his name is Ray McCaskey, several years ago said that their biggest competitor was no insurance at all. And people simply dropping coverage. The other phenomenon that's been increasing rapidly, according to the Kaiser Family Foundation, are the number of individuals who do have access to health insurance. They're just not taking it up. They want to roll the dice. They're young, they're healthy, they're immortal, and they don't want the payroll deduction. They need the money to keep paying for the Toyota. And Toyota says, thank you. But if they get sick, they've got a problem. And COBRA you all know about, I'm not going to dwell on that. Medicaid has picked up some of the slack. The stimulus package is helping the states some, but that's on S-chip. That's not on the unemployed, that's on S-chip. And so at the same time that that's happening, it's hitting the hospitals hard. And so they're out of cash. And they're out of cash for all sorts of reasons. Their access to capital has gone way down, and their investments have dried up and so forth. But also, the number of high-margin elective procedures are going down. You make your margin sticking things into people and taking them out of people and putting devices in and so forth. It's a cash flow problem. You've got to buy that device, put it on a shelf, and then wait until you put it into somebody before you can bill for it. But still, there's a lot of margin in that business. That's going down. When the internist guys like me, when we admit patients to the hospital, you lose money almost every time. So, it's been exacerbated. This is almost all elective stuff. And so showing up in more worrisome ways, too. This is stuff that consumers are doing because of economic problems that we're not going to see a short-term problem with, but we may well see it in the long term. Splitting pills, for example, or sharing medicine, or not getting it filled at all, not going to the doctor, not getting your follow-up done. Not getting a test done is cheap. And I've talked to several medical directors within the last couple of months who said they're enjoying a utilization holiday. People just aren't getting stuff done. Oh, good, great. So don't get that mammogram done or the pap smear or something that's screening. Remember, prevention doesn't always have a financial ROI. Statins cost a lot of money. Screening for cholesterol costs a lot of money. It's the right thing to do, but in fact, it's a silent disease. If you don't do it, people kind of motor along and they're just fine until boom, they fall over dead. It's not expensive, okay? So you spend money doing stuff like that. We do it because it's the right thing to do. But if you're starting to avoid this now as a consumer, we may well pay for this in the long run. So we need to evolve the model of consumerism. At the height of our hubris, we were talking about, well, we're moving from managing a condition to managing overall health. Now we're going to manage wealth because the boomers are coming in with their saved up money. Gone now, but let's be serious. Who really wants their health plan to manage their money for them? There are surveys yet today. Health insurance companies are always at the bottom of who's a public trust. There are surveys yet today in which insurance companies rank lower than banks. Banks, I'll say that again. Banks. They're still higher. Okay, so we gotta get past ourselves and start to look at what we need to do. And some of this is going to be focused on the chronically ill. Some of it is going to be focused on a population basis, those who are healthy, those that we want to prevent. They're not the same. One size does not fit all. And my last slide basically is here to try and nail that point down a little harder. I started with a Rubik's Cube, wasn't enough. I added a layer all around and then had to stop because you can't read that font as it is. But we like to put things in as though everyone's the same, but they're not. They're not. Do you speak English? Do you not speak English? Are you mobile? Can you get to a provider? Can you get to the far distant testing facility? Are you elderly? Are you not elderly? Is it your spouse or your child who is sick? Talk about emotion. People say, what makes health insurance different? It's actually a lot of things. But one of the things, I mean, if you have a fight with State Farm over how much they're going to pay for a dent in your car, you get irritated. If you have to fight with your insurance company over whether you're going to cover a procedure, you peg the needle. There's nothing as emotional as stuff like that. So the emotional content is sky high. There are just a ton of things in there. The worried well, the deniers. Very different ways of thinking. They have very different needs. They have very different times when they need it. We haven't really incorporated this well yet, though I will say, when we were looking at the applicants and the finalists in particular and the winners in this best practices group, sometimes this was done. Maybe not to a fine level of detail, but that's not a negative because nobody could do it at a fine level of detail yet. The only ones who do this at a fine level of detail are people who are marketing a very narrow type of product in the retail sector, and they're only going for a small slice. They analyze it pretty good. We need to get away from the old advertising ideas of dual income, no kids, the young and the immortals. That's fine. That was a way to get thinking about it. We're going to have to move past that. And that's it for me. Thank you.